Good morning and good afternoon to our friends connecting in from all over the globe. Welcome to HSG 2021 Family Day. And thank you for joining us to hear a quick overview of who is the Huntington Study Group. My name is Shari Kinel. I'm the CEO of the Huntington Study Group, and I, together with Dr. Andy Feigin, HSG Chair, and Elise, Kayson, HSG Co-Chair, are going to share the stage with you to give you a window into who we are and what we do. Andy's going to say a quick hello, and then Elise.
Hi, everyone. Thanks so much for joining us today. I'm Andy Feigin, as Shari just mentioned, chair of the Huntington Study Group, and it's my pleasure to be here today to tell you about what the Huntington Study Group does. Elise.
Hi, I'm Elise Kayson, and I'm here to talk to you today about how the Huntington Study Group can help you. And I also want to say that we're pleased to be here today and thank all of you for your support and participation in our clinical trials, because without your participation, there would be no clinical trials or finding treatments that make a difference.
Great, thank you. Next slide. So who's the HSG? We're an organization of researchers who work together with the community and sponsors, seeking treatments that make a difference for people affected by HD. That is our mission. It takes a village to do the work we do. It takes researchers, investigators, coordinators, clinicians, and most importantly, you, the HD community, are all part of that village. Next slide, please. So now I'm going to share a high-level overview of our organization. The Huntington Study Group is a not-for-profit organization whose mission is to seek treatments that make a difference for people affected by HD. And through the Huntington Study Group, we provide programs like Family Day, and we provide education programs and scientific and other research projects to address the needs of the community. You're going to hear more about these in a minute. We also run clinical trials like the PROOF trial, which some of you may be participating in. There are a lot of operations that are needed to run trials, so we formed a for-profit subsidiary of the HSG called the HSG Clinical Research, Inc. to run the operations of our trials. HSG Clinical Research, Inc. is a wholly owned subsidiary of the HSG. Simply, the HSG owns HSG Clinical Research, Inc. And our financial model allows all the net profit of our clinical trials to get reinvested into the HSG so that we can develop and provide impactful programs for the HD community. Our goal is to find treatments for people effective but with HD through the research and trials, studies, and programs we conduct. But in order to design trials and programs that address the needs of the community, we need to learn from you, and you're going to hear more about that in a few minutes. Next slide.
The HSG got its start actually in 1993. By coincidence in some ways, but maybe not. 1993 was the year that the gene mutation for HD that causes HD was identified, largely through the work of Nancy Wexler and her group in the Venezuela research project. I actually was privileged to be part of the Venezuela research project and went to Venezuela as part of that project for 9 or 10 years. And I was actually present in Venezuela in 1993 when it was announced that the gene mutation for Huntington's disease had been identified. After all that work and the identification of the gene mutation that causes Huntington's disease, Dr. Ira Schulson recognized that there was going to be a need for a collaborative group to do clinical trials for Huntington's disease. That Huntington's disease is a relatively uncommon disease, and so that sites worldwide would have to work together to do the clinical trials that were going to be necessary to develop the treatments that would make a difference for people with Huntington's disease. So Dr. Schulson created the Huntington Study Group in 1993. It started as a very small organization. And since 1993, in the last 28 years, it has grown substantially, as you'll be hearing about. Next slide.
In the next few minutes, I'm going to walk you through the HSG's incredible timeline of success. Between 1993 and 2001, the HSG has conducted the most clinical trials and studies in HD. And as you heard from Andy, this all started in 1993 when Ira Scholson and a number of other individuals recognized with the identification of the gene the need to initiate clinical trials for patients and families. By 1996, the HSG had developed and validated the assessment tool that is used as the primary outcome measure in all clinical trials, called the UHDRS, or the Unified Huntington's Disease Rating Scale. This is a cornerstone of clinical care, and the landmark UHDRS publication, and there is a video, can be found in the 1996 movement disorder issue. In 2008, based on the clinical trials conducted by the HSG, tetrabenazine was the first drug approved for FDA for the treatment of chorea in HD. In 2010, the HSG conducted a study called Project Aware, and you'll hear more about it, but it was to learn about HD patients' awareness, willingness, and ability to participate in clinical studies. This study has been beneficial to how we design protocols, recruit subjects, and maintain engagement of study participants. In 2015, again, based on clinical trials conducted by the HSG, tetrabenazine became the second drug approved by the FDA for the treatment of chorea in HD. Between 2015 and 2019, the HSG initiated and conducted 3 large clinical trials. Signal, which was a monoclonal antibody IV infusion, Connect HD, which used a drug called valbenazine, and Connect HD2, which is an open label study and is still currently recruiting participants. So please contact the center closest to you if you are interested in this study. The sites for this Connect HD2 are located on HSG's website. We also initiated a study called HD Care Improvement Project. This was initiated to look at issues related to the needs and care of HD patients and families. Next slide. In 2020, we had challenging times in the midst of a pandemic, hurricane, and a Texas winter storm. The HSG completed the Signal study of over 300 participants and produced top-line results. We also reinitiated and completed Connect HD2 and implemented initiated Connect HD and implemented Connect HD2. We also started a global phase 3, 480 subject study called Proof HD with the sponsor Prelenia. All these studies reached their enrollment targets either ahead of schedule or on time. Totally amazing, and a huge thank you goes out to all of you, our participants who were part of these trials, for without you, we could not have done this. In addition, the HSG was also very busy updating our online CME for HD for care providers. We added new site investigator coordinator classes on conducting clinical trials through our HD member ed. And we also re-engineered our HSG credentialing process. If that wasn't enough, the HSG began the development of a new platform for HD patients and families. And that platform is called My HD Story. It's an observational study for the voice of those affected by HD. You will hear more about this in a little bit. And the HSG also initiated the development of virtual UHDRS. And this is a study to look at the feasibility of conducting the UHDRS remotely. And this may be helpful in future clinical trials so that we can reduce the burden for patients and families of having to come into a center. And we may be able to have hybrid studies where we can do some inpatient visits and some visits in the comfort of your own home. We also found out the results from the Hdnet study, which were published and presented in major forums. Well, this was a really an incredible journey that we had over the past couple years, and we are all grateful to you, our participants and families who helped make this possible. Next slide. Also, over the past 28 years, we've been growing our global HD research network. We now have over 800 HD expert members. We have over 20,000 HD participants at our HSG sites, and we have credentialed 131 HSG sites worldwide. And below is a map of where we have HSG sites. Next slide.
So what does it mean to be seeking treatments that make a difference for patients and families with HD? Next slide, please. So conducting clinical trials to seek treatments involves many, many steps and many, many pieces of a puzzle that have to be put together to develop a clinical trial and to conduct a clinical trial. So the HSG does all of these things. We plan trials with potential sponsors. We convene patient and scientific advisory boards. I think I'd like to really emphasize the patient advisory board side of it. We do like to include patients' opinions about clinical trials, about the mechanisms of drugs, and about the clinical trial design. Is it something that patients could do easily or would be enthusiastic about participating in? And so we do this on a regular basis when we're planning our clinical trials. We build study teams. We work with the sponsors and with vendors to do all kinds of things that have to happen as part of clinical trials, EKGs and blood tests and various other aspects of data management. And we work with our sites. We pick sites and work with our sites to recruit participants, which is, of course, critical to conducting clinical trials. Patients and families need to be engaged and need to agree to participate. And actually, we've been really lucky over the past several years in that patients seem to have embraced the trials that we've been involved in and have really stepped up and participated. And we are extremely grateful for that. And that's the reason we're able to do these trials and continue to try to find treatments that will make a difference for people. And then, of course, the final step in clinical trials is that we report the results and communicate the results, not only to the scientific community, but also to patients and families. I think that's something that really sets the HSG apart, is that we're very, very conscious of thanking our participants by having regular calls, even during the conduct of a clinical trial, about how it's going and giving feedback on what we're learning from the trial. So the HSG puts all of these pieces together to conduct clinical trials focused on Huntington's disease. Next slide. So I made this point already, but the participants really make all the difference. And so we send out a huge thank you for your participation over the past 28 years in the 38 Huntington's disease clinical trials and studies that we've conducted, that the HSG has conducted. These trials have included many actual clinical trials, but also observational studies such as Pharos and Cohort and Registry as well. So in any event, these trials, which have been very productive, have provided a huge amount of knowledge for us that have made us get better and better at doing clinical trials, could not have happened without the participation of patients and families. So thank you so much. Next slide. And as Elise has mentioned, we have conducted the only 2 trials that led to FDA approval of drugs for the treatment of Huntington's disease, that is tetrabenazine and deutetrabenazine. And so, so far we have accounted for the only two drugs that have received FDA approval for the treatment of Huntington's disease, and we're hoping to add to this list in the near future. Next slide. So seeking treatments for Huntington's disease requires knowledge. And so how do we gain that knowledge? Next slide. Well, one thing that's, I think, really important to point out is that participation in clinical trials is important because we learn from clinical trials whether they're positive, negative, or equivocal. And we learn from clinical trials that are not only our clinical trials. Obviously, we learn a lot from HSG clinical trials, but we even learn from trials that are being done by others. And an example, I think a good example is the recent kind of disappointment from the Roche Ionis trial. I think everybody was disappointed in the early stoppage of that trial. On the other hand, I would put a positive spin on it and say that we're learning a huge amount from the data from that trial. And much of what we're learning is going to make us better at doing clinical trials in the future. So I think first and foremost, we learn from clinical trials and clinical research, whether or not the results produce an actual drug or treatment for people with Huntington's disease. We learn in many other ways, and I'm going to turn it over to Shari to talk about some of those ways as well.
Thanks, Andy. So this village I mentioned earlier, the village of the community, clinicians, researchers, informs us to help us design trials and projects that are going to meet the needs of the HD community. And as Elise mentioned during the timeline, we conducted a study, Project Aware, which again stands for Awareness, Willingness, and Ability for Research, where we surveyed 500 patients and care partners to understand the barriers to participation in trials. And we found that a big barrier to participation is travel and geography to the sites, geography near the sites, access. Since this study we built, since Project Aware, we built into our trials more travel opportunities, more telephone visits, and you're going to hear about some of the virtual opportunities we've included and will include in our trials. We also wanted to understand the gaps that people face in care. So we surveyed 800 HD families in the HD Care Improvement Project sponsored by the Griffin Foundation, and also found that a key barrier to receiving expert HD care in the United States is geography and costs. Again, access. And then Genentech sponsored a research project to seek knowledge about gaps in care from the clinician's perspective and the healthcare provider's perspective. So in HDNet, we surveyed 150 healthcare providers in the United States, where we found that HD care is inconsistently applied in the United States, and also access to quality care is a big barrier. So please check out the HDNet poster in the poster pavilion to learn more about the HDNet project. Okay, next slide.
Thank you. Some of the key barriers that we have found with clinical trials are access, as Shari mentioned, to clinical sites. So one of the things that we are embarking on is this platform called My HD Story. And this is a place for patients and families to come and make their voice heard. And especially this will be helpful for people who aren't able to make it to a clinical site, but want to participate, and they can do so in the comfort of their own home. There will be a number of patient-reported outcome measures on this website, and you will hear more about this later on. We also developed and are in the process of developing a study called Virtual UHDRS. Again, this is the Unified Huntington's Disease Rating Scale. This is the primary endpoint for many of our clinical trials. And this is going to be a study looking at the reliability of doing the UHDRS remotely. So when we're looking at the future of new trial designs, being able to conduct this assessment remotely will enable us to create hybrid study visits, which means that we can do some of the visits in the comfort of your own home, and we can do some of the visits at a clinical site. We've also implemented studies using wearable sensors, gathering daily information about how the body functions may tell us more about the HD disease than how if you're seeing somebody at one point in time. So the Connect HD study that maybe many of you are part of includes a sub-study using a wearable sensor. Next slide. The HSG also is seeking treatments that require sharing knowledge and experience. We have a robust education and training program. And CME for HD, which is led by Dr. Mary Edmondson, is an accredited learning program for healthcare providers and care providers caring for individuals and families impacted by HD. We also have what we call HSG Ed, and this is led by Jody Goldstein and Sam Frank. And this is an education program for investigators and coordinators dedicated to the nuts and bolts of conducting clinical trials. The program is in place to make sure our sites are trial ready and ready to start a clinical trial at any point in time. We also have a periodical called HD Insight, and this is led by Daniel Clausen. And this periodical highlights the latest HD research and the people who make it happen. And then we also have our HSG annual meeting, which has been occurring for the past 28 years. And this is a place for everyone to gather, researchers, patients, and families, to learn together and to share their knowledge and experience. Next slide.
Thank you, Elise. And I just also want to mention with our CME for HD program that a lot of family members, caregivers can access CME for HD and learn about different aspects of managing care with the disease. And we have found that some of our community members actually have brought some of the information that they've learned to their own clinicians in terms of managing care. So I strongly should suggest you go on our website and check out CME for HD. So speaking of websites, to get there, www.huntingtonstudygroup.org. We have a lot of social media. We are on Facebook, Instagram, Twitter. We have a YouTube account, LinkedIn. So follow us. And also, it's a great opportunity. If you do follow us, you can see when we launch new clinical trials, and you'll learn about when that happens, as well as stay tuned for my HD story, because hopefully that's going to go live in the next few months. If you have questions, info@hsglimited.org, your questions will be answered within 24 hours. So it doesn't go into a black box. We pay attention to every email we get. We also have an 800 number, 1-800-487-7671, where you can contact us and your phone calls will be answered. Next slide, please. And we also have on our website, under the HSG Clinical Trials and Research tab, it says, contact me about future research. If you click on that and you sign up to learn about future trials, it's real simple. You will get email blasts when a new trial is enrolling, and then it's a quick way to learn about new research that's coming down the pipeline. Next slide. And again, here is our contact information. And it should be on our program too, and you'll find it on the Intrado platform. So please reach out, say hello. We'd love to hear from you. So thank you all so very much for staying tuned and listening to us give a little update on Huntington Study Group and who we are. I hope you found it interesting. If you have any follow-up questions, please reach out to any one of us. And thank you. Have a wonderful time at Family Day. I don't know, Andy and Elise, you want to say?
Yeah, thank you so much for joining us today. And please stay involved. Yeah, and we really welcome your participation and continued participation even after today.
Yep.
And just thank you again. It's great to be here with all of you, and thank you for participating in our clinical trials or any clinical trial. And without you, we would not be able to make a difference. So we look forward to hearing the rest of this program and meeting you next year in person.
Yes.
Bye.
Bye.
Take care.